This is success rate, okay, of IVF according to the age. 2 minutes started, okay?
Yes, ma'am. Yes, ma'am. Next page. Is there any other page, ma'am? Any other page, ma'am?
No. Started your 10 minutes time.
Hi, I'm Dr. Shaiksa, one of the doctors in the clinic today. May I confirm your name and age, please?
Yeah, I am Fanny and I am 60-year-old.
And how may I address you?
Fanny is fine.
Mhm. Fanny, first of all, I apologize. Your notes are not with me. They are in the transit from the record. I am looking into the matter once they are retrieved, and then I will let you know. However, I have your discharge summary with me. Okay.
Oh, yeah, doctor.
What I understood from your discharge summary that you had surgery of your prolapse 8 weeks ago, and now you have backache and problem with your water work. Am I right?
Yeah.
Mm-hmm. Any other concerns apart from that?
Yeah, I do have few questions regarding my routine activities,
Mm-hmm.
and I do have concerns regarding joining my office. All those are my concerns.
Yeah, sure. I will address all your concerns in a while. But before that, is it okay if I ask you a couple of questions to know more about you so that we can
Yeah,
go ahead with? Mm-hmm.
yeah,
Okay.
yeah.
Fanny, could you tell me more about your condition? How is your recovery from after surgery?
Now I don't have any pain, doctor, but this backache is very severe. At a time, I need to take tablets.
Mm-hmm. Okay. So this backache is after the surgery, or you had it before as well?
No, after the surgery.
Mm-hmm. And what about your water was?
Actually, doctor, my water work also I have noticed it recently. I need to rush to the toilets and I need to go quite frequently. Even at night also, I have to wake up.
So how many times do you go to the toilet in the day and night?
Oh, I quite go frequently.
Okay. What about your water intake and caffeine intake?
I'm not taking it. I'm
Hmm.
taking adequate water, no caffeinated drink.
Any leak before going to the toilet?
No,
Any pain while peeing or fever?
no,
Any discharge on pillow?
no,
Do you leak on coughing or sneezing?
no,
Mhm. Any problem while peeing, like straining or dribbling afterwards?
no,
Did you notice any blood in the urine?
no.
Mhm. Okay. So, this problem is after the surgery or you had it before as well?
No, after my surgery only I have noticed this problem.
Okay. So, may I know the reason of your surgery? I can understand it was prolapse. So, may I know the reason of
Yeah,
your first
doctor.
surgery? Mm-hmm.
Actually, I had hysterectomy 8 to 10 year back.
Mm-hmm.
Because I was having some heavy bleeding at that time. They had understand. They took a biopsy and they said if I will not undergo this surgery, it might turn
Mm-hmm.
into a cancer. So I decided to go for surgery, and they removed it normally at that time. There wasn't any concern.
Okay, so the histopatho report, the biopsy report was normal, right?
Yeah,
All right. And moreover, may I know how many kids do you have?
I'm having 4 kids.
How were they delivered?
They've delivered all vaginal. Yeah, they were difficult, prolonged deliveries. In two of my babies, they need a forceps also.
Okay. So was there any tears afterwards? How was the recovery
Oh,
after?
no, no, no.
All right. All right. Okay. So may I know, do you have any problem with your opening of the bowel?
Not after the surgery. Before surgery, yeah, I need to evacuate or used to
Mhm.
use my fingers to remove the stools. Now,
Were
not.
you catheterized? Okay. 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 So were you catheterized after the surgery? Did they pass?
Yeah, I was catheterized for a day. After
Mhm.
that, they had removed it, although there was some difficulty initially, but now after that, I was fine.
All right. And may I know about your cervical screening? Was it normal before?
My hysterectomy was 10 years back, doctor.
Okay. Okay. And do you have any medical problems like diabetes, hypertension, any nerve problem,
No,
any other surgeries apart from these two surgeries?
no,
Are you allergic to anything?
none,
And do you smoke or drink alcohol?
no.
May I know your weight and height ratio?
It's 27, 28 up around.
Mhm. I believe you are not. Are you allergic to anything?
No, I told you, doctor, I'm not allergic.
Okay. Okay. And moreover, how is the support at home?
I am having a big family. I'm very well supported. My husband is there.
Good to know that, Fanny. And what do you do for a living?
No, I am not doing anything as of now. I have took a break for this surgery. Otherwise, I go to a shop as a shopkeeper.
Mhm. Okay, Fanny. And moreover, one intrusive questions. Can I proceed?
Yeah.
Are you sexually active? Did you resume the sex
Oh,
after the?
actually, I am really worried about that also. Since
Mm,
how, since what, when we can start our sexual life? Because initially, before that also, since I was having this wall prolapse, I was not
mm.
having any sexual intercourse. So I wanted to ask that also.
Yeah, yeah, sure. I will address. I will check and let you know what is the problem. Okay. So, thank you very much for the information. Would you like to add anything else, Vinny?
No.
Hmm. I would like to check you in the presence of chaperone. My nurse will check your general well-being, and I will check you from down below to see the status of the wound. Would that be okay?
Yeah.
Thank you very much for the cooperation, Fanny. Now come to your concern why you have still backache and why you are having these problems. So I can see you are alone today. Would you like someone to be with you before
No, doctor, it's
going?
okay.
Okay. So I am suspecting that you are having one of the complication of this procedure, sacro-colpopexy, backache and problems with the urine. They are quite common. About 15 out of 100 women they suffer because of this surgery. But don't worry, Penny, you will be managed by our expert team of health specialists, including my consultant. We will involve the Urogyn surgeon, counselors, GP support groups in your case. Okay.
Okay.
I'm going to send few blood, urine in. I'm going to send your urine to see if you have any infection. If infection, I will give you the antibiotics after ruling out of allergies. And may I know, so far, are you on any treatment because of these problems?
No.
Hmm. So I'm going to give you one diary, that is bladder diary or fluid diary. You have to maintain this. My nurse will guide you how to fill this diary, and you have to maintain that diary. I'm suspecting you are having overactive bladder. This is one of the complication. Have you ever heard about that?
No, doctor, what it is?
Actually, in this condition, what happens? Let me explain you. Our water bag, it holds the urine because it is surrounded by the muscle. It holds the urine once when it is filled. Then there is contraction and we pee, but in the toilet. But what happens sometimes? This muscle contracts unnecessarily without any warning, even with small quantity of urine. So that's why you are having frequency and urgency. Are you with me so far?
Okay.
Hmm. So after doing some investigations like bladder diary or urine test, will refer one. I will refer you to the bladder training specialist, physiotherapist. He will guide you about the training of the bladder, in which we guide you how to hold the urine, and in this way we will increase the time of voiding. Okay.
Okay.
And moreover, we will check you if these simple measures they are not effective. In that case, we will give you some medicines. We have the medicines and other invasive procedures as well as we have anticholinergic medicines. These medicines will calm down your bladder. We have medicine like oxybutynin, tolterodine,
And what
derifenacin.
about backache, doctor? What about backache?
Backache is also common after this procedure. We will give you the simple. Are you on any medicine? We'll give you simple painkillers.
No,
If
as
it
of
is,
now, I am taking painkillers only.
this is one of the complication of the surgery. I will give you the strong painkiller. If it is not relieved, then uh, uh, we will investigate again.
Okay.
May I know, do you have any pain relief from the back?
I do, means, yeah, once I took a painkiller, I do have a relief, but I'm just worried, means, still how long I'm going to have this pain. Um,
Yeah, I will involve the pain relief doctor as well in your case, and he will guide you more about if this is because of the injection in the back, and then definitely there will be the treatment for that as well. Okay, we will give you simple massage for that and painkillers.
okay.
And moreover, after the treatment, medical treatment, we will see the result. Usually, there is a response after 4 weeks. There are certain complications like dry mouth, constipation, and blurring of vision. If it is not
Hmm.
relieved, then there are other medicines like Mirabegron, and we will assess you at that time before giving that. If again it doesn't work, then your case will be discussed with our specialist team of health specialists, and you might need one sophisticated test, that is urodynamic study, in which we will see how your bladder is functioning. We will check the capacity of your bladder as well to diagnose this condition, overactive bladder. Okay.
Okay, doctor.
And moreover, if it is diagnosed, then there is another treatment in which we put the Botox injection in the bladder to calm down the bladder. The side effect is like retention of urine, but we will let you know how to tackle this condition later on if need arises. If again it is not effective, then we have some nerve stimulation techniques from the back, and surgery is the last resort in which there is urinary diversion and some uh, and sophisticated surgeries. But I don't think there is a need of these, but definitely we will guide you. Up till now, do you have any other questions?
No, thank you, doctor. 12 minutes.
I can see I have given you a lot of information. I'm going to give you some information leaflets, number of support groups, and fixing your next appointment with my consultant.
Thank you.
Thank you.
Your own reflection. Then, whosoever are there today, please comment on her performance. Then I will give my feedback and answer. Your own reflection.
Ma'am, her concern was when I have to go to the work. So definitely after
When
investigation.
you, yeah, when you are going to offer me, when, see, you, I'm going to fail you. None of my
Yes.
concern you have addressed. I told you I'm having sexual difficulties. I'm having pain. Can I go? Can I start my routine work? Can I, means routine I am doing, but okay, still I can go for extensive, maybe going outing, going for shopping, all those things. Can I go to my workplace? Any of these concerns did you answer? Many a
Uh,
times people think that they will answer these concerns. You asked me very nicely, you asked me all concerns. You signposted sexual history or sexual concern was my hidden agenda. If you can, you wanted to see, that was my hidden agenda. I would not have said unless and until you would have elicited that history. You had addressed everything. You asked me, asked, you had not addressed anything. You asked me all the concerns. None of the concerns was addressed. You took
yeah.
altogether this station towards OAB, which is not a
Yes,
station.
yes, yes. Yes,
Addressing
ma'am. Key
concerns are
concern. There were key
always,
concerns. I noticed that Beckett did sexual activity, and when I have to go to the work, these were the main concern. But once her condition is stabilized, then she can
why
have all these.
OAB, why OAB, why you think? I am just having these new onset symptoms recently, but backache, yes, definitely. But at least say something, na dear, say something. Regarding sexual concern, what I would have said then and there only, rather than saying I will answer, I will address your concerns. Say someone only one thing: if you are comfortable, you can try
Mm,
for sexual intercourse if you are comfortable, because it's
once, yeah.
eight
Yes, ma'am.
weeks 8 weeks. Okay, that means
Yes, yes, yes.
almost 2 months has been passed. So if you are comfortable, you can.
Yes,
Same
ma'am.
thing goes for her routine activities. If she is comfortable, and backache and overactive bladder will not be affecting her outing and affecting her ability to go to hospital, go to work, she can resume her work.
Mm,
She can resume her routine activities. She can resume her sexual activities. This is actually the task is explaining me about vault prolapse, vault surgery, what exactly you have done it. And yes, sometimes because of the surgery, there are new onset symptoms like backache, some new symptoms with the bladder. But over a time period, many of these symptoms disappear. That is reassuring. The task should be reassuring, rather than that you frightened me with Botox, with you frightened me with augmentation cystoplasty.
yes, ma'am.
Yeah, so if this is a case, what the examiner will do?
He will fail me. Yeah.
Yes, and you will think,
Because main
yeah, you will
concern.
think. See, my task is wherever you are going to take me, I will be going in that direction. Still, I tried to bring back to you. I tried to bring back to the points where I wanted you, but then you were not listening. You were taking me to that direction. I was like, okay, forget her. Let let she guide me where she wanted to tell me. See, if the
Mm,
patient, the first line treatment is bladder training, dear. And max to max, you can just tell her that most of the time, simple bladder training exercises, restricting your fluid, restricting your caffeine will minimizes these symptoms, and continue physiotherapy, continue, because backache and both the things will require physiotherapy. If at all it will not get resolved, then yes, we will look into the matter and may discuss the further action. But as of
yes,
now,
ma'am.
eventually over a time period, this will disappear. That is what you
Yes.
are going to say.
Mm, mm.
Okay.
Yes,
So,
ma'am. You are right.
yeah, so this is a task. This is a task. Now, anybody else wanted to comment on her performance? Experts,
No,
all of
ma'am,
you
she
are now
did well.
experts.
Ma'am, I thought she did well, but when you were asking question like you didn't counsel, then I noticed yes, counseling was only missing. Otherwise, she did everything. Physiotherapist she could have told. Otherwise, so she was yeah, she was talking
No, I
about the
will
overactive
fail her.
bladder.
I will fail her.
Yeah, though, but I think counseling was required from the very beginning. then it could have been a better station.
Once the post-operative patient comes to you with some complications, will you fight? Unless and until, yes. If that complication is something which requires urgent intention, then only you are going to escalate her care. At this
That's
Yes,
point, it is reassurance. Identify
yes,
the
yes.
task. Identify the task. She had come to ask you regarding when I can go home, when I can go to shopping, when I can go to work. Can I resume my sexual activities because of that walled prolapse? I was not able to. Okay.
yes,
So these
Yes,
were my
ma'am.
concerns, and you took that stations towards OAB completely. No, not fair.
Mm.
You will
First counseling should be there. Yes, ma'am.
OAB. See, it's although you she mentioned, na, these are the complications of surgery. Okay.
Mm. Yes, ma'am.
And reassure us. But I just wanted to tell you, eventually, over a time period, these symptoms will disappear. If you try first, physiotherapy, second, restrict your fluid intake, third, bladder training. With this simple measures, it will go off. She has not discussed all this problem with anyone now. Why you want to formulate MDT and all those things? No, not needed.
yes, yes, ma'am. Right. These are the simple things, and we skip. Mm.
Yeah. So they wanted to have a simple things. You many a times confused. You got
Yes,
confused. No, this is the task regarding OAB.
right, ma'am.
Okay. Now
Okay.
one more important point. Okay. Now coming to the points what I had 8 weeks. Means you start on a very good note, very positive note. You started. Okay, all right. You are also saying many times, but very good, very nicely. You are humming also at a time. So I really liked it. Cervical smear out of blue, from where it has come, I don't know. Uh,
Yes, ma'am.
okay. Now what I had wanted to tell you. One important question you missed out in the history.
Any difficulty
Any
during
skin color
op-
changes?
operative
Hmm?
notes? I have to check.
No, any?
Skin color
Any med-
changes or any dragging sensation, and also this reviewing her operative
No,
notes.
no, 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 no. I didn't say that word, but you couldn't elicitate that. Hysterectomy route. Did I mention route of
Okay,
hysterectomy?
okay, okay. Yes, yes.
If it is abdominal, the chances of fault prolapse is less. If it is vaginal, the chances of fault prolapse is more. Family history of
yes,
prolapse also could have been a one question rather than support.
yes, ma'am.
Hmm? Okay. BMI you asked. So it is not BBN, so no need of anyone. That is
Right.
another point. Okay, no need of anyone. Did someone debrief you about the surgery? You can ask whenever the patient is having surgery or any post-operative appointment with you, because that
Yes.
might be in their answer key. They wanted you to explain about what surgery you had done.
Mm.
Okay.
Right, ma'am.
So my concerns are why I'm still having backache, why do I have bladder symptoms, and one more point, one more point. Why you mentioned that it could be because of spinal anesthesia, the backache will be. See, if this kind of things you will say, it is not evidence based. All of us know, even at least I am having a backache after my C-section, after my spinal injury, spinal anesthesia. But the literature, what the literature is saying, no, this will not give you any backache. So why you said that sentence, I didn't understand. Spinal, yeah, because of this needle, something like that you mentioned there. Yes,
But
that also
ma'am,
I
I told
found.
any anesthesia on the back. So because I have to involve the anesthetist,
No,
that's why.
no, 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 no. See, the surgery is fixing that tape at your sacral promontory, and that
Mhm.
might be giving you a backache.
Yes, ma'am.
Simple measures. Okay, eventually it will go off. It will go off. But yes, physiotherapy, stretches, yoga, relaxation techniques, all those you need to tell her, including painkiller. So that is one thing. Can I have a sexual intercourse as any test? I am okay with waterworks. Are there any tests that will say that I am okay and that my water work are also okay? You can say that if not getting treated, then you further tests will be discussed with you by a MDT. That one sentence, not more than that. What do I need to do to make things better? A good candidate. Okay, now coming to the answer key. Situational awareness, very nicely you mentioned. While we are awaiting, I have your case details. So can we go off? So post surgery follow up. You acknowledge that she's a post surgical follow up, 8 weeks with two some symptoms. Questions: address concerns, setting agenda and addressing concerns. In the beginning only you asked all the concerns very nicely. How is her recovery? That was you asked me. Okay, elaborate me in detail about bladder complaints. Any new symptoms? So is it new symptom or was it the previous symptoms only? No, this is there after the surgery. Urge leak means you asked me everything. Urge, but you were repeating this history, huh? What I had noticed, you repeated leaking twice. You repeated pain twice. Then so this history in Urogyn module, this thing. Do you leak? Urge, do you rush? So these sentences should be very small and it should be sequential so that you will elicit the history of urge incontinence, you will elicit the history of stress urinary incontinence, you will elicit the history of retention, stream, incomplete evacuation, hesitancy, pain, that is dysuria, frequency. And how many times do you, I am not remembering there how many times I do need to go. Yes, I need to go quite frequently. Okay, so these
Yes.
sentences, if you can make it a simple sentence, because that those sentences are very important and those questions are very important to know what kind of urinary symptoms you are having. Are you satisfied with surgery? Yes, I'm really very happy because yes, I was having severe dragging sensation and it was not means comfortable feeling. Definitely, I'm happy. It has improved my quality of life. Drinking adequate water. Keep doing that. Avoid alcohol and caffeinated drinks. That is what for OAB. What symptoms you had previously? What hysterectomy? Route of hysterectomy is important. Why hysterectomy? Root of hysterectomy is very important. And what about your backache? Is it better or worse? Any leg pain? Any means is it bothering you? Leg pain is means sciatica and all those things. Okay, avoid lifting lifting weights for 8 weeks in total. Okay, so those was the instructions which was given to her. Any other medical illness, BP, DM, allergy, any medication she's on? No. Sexual history, very nicely signposted and take ask you asked me. Okay, wound check and guide. But if you are comfortable, so here my send address, I am addressing her concern here only. Okay. Yes, let me check the wound. If healthy and if you are comfortable, you can resume your sexual activities. Okay, wound check and you are comfortable. So this is very good. Here you can offer this patient an examination because she's having multiple concerns and you wanted to ensure that her wound is absolutely healthy. She's not having any problem. Have you started your routine activities? What about your thoughts about resuming work? Uh, Miss, the patient is having a resuming work. I feel to join back to work, but can you give me a fitness? Yes, I will. If you are comfortable, I can definitely give you a fitness to join or to resume your duties. Do now here you can what you had asked me. Do you have adequate support at home? So I if there will be a lay, I will ask in a different way. Do you have someone to help at your home? Because after surgery, rather than asking support, do you have someone at home to help you around with your routine work? Hmm? So that question makes a very impact. Support is a very common means support is something which I feel okay. If you are not comfortable using a specific sentence, then support can be used. But if you can, this kind of things or this kind of sentences after post-surgical procedures can be used. Mm, Anything you wanted to add? Are you aware about surgery? Shall I explain to you? So this is another thing. Someone debrief you regarding the surgery. If not, please explain her. Yes, in your surgery, what we had done, the top of the vagina. Okay, to support top of the vagina, the surgery was performed through a tummy, and this was stitched back to the sacral promontory or a backbone. And this stitching back to a or this tape which has been fixed to your sacral promontory is giving you this pain. Okay, that is a cause of pain or dragging what you are having, or it is bothering you. Very nicely you had given me the numbers. I'm happy I have not mentioned in my answer key. It gets better with time, but can take you can till that time you can take a help of painkillers, some massaging with warm oil, and if not getting relieved, you can also take a help of physiotherapy. So can I refer you to a physiotherapist for this? So now, whenever we discuss the procedure, it pros and cons generally we discuss. So in the consent only, we might have explained to you that whenever we support the wall, sometimes there might be a new onset bladder problem. Some new onset bladder problem, like rushing to a toilet frequently. But do not worry, it is treatable condition. Uh, and we will try to resolve it. So it's a complication. So backache and overactive bladder or urge incontinence, here you can say, they are a complication of a procedure, needs conservative treatment at present. Do not get panic. Physiotherapy, yoga, relaxation technique, bladder diary you mentioned, fluid diary you mentioned, bladder training you mentioned, PFMT, and most of the time with these simple measures, your symptoms will go off. You may not require any further management. But if at all, it will not get relieved, do not worry. In that case, I will refer you to the expert urogyn specialist and formulate your further care in MDT. I will not discuss here the surgery like Botox or augmentation cystoplasty. No. My thing is this only. I have to guide her now. What will be her next plan? Painkillers for backache. If less response to conservative management, I can prescribe you. And now regarding the address missing case details, I need to go, I need to check, and it will give me detailed idea about procedure. So I will go through the detail with your permission. Once the case details will be available with me, I can go through it and I will discuss in detail with your permission. Reassurance responded to reassurance should be the again you can reassure her. You will respond to treatment over a time period. Yes, you need to be till that time. Continue physiotherapy, continue bladder training, avoid caffeinated drink, and if you are fit, I can write a fitness certificate also. And close the loop is my last point or end of the task. Bladder and Bowel Found UK Foundation is my support group when it comes to this Eurogyny module. Coming to exam mark domain-wise scoring. Communication with patient and relative. Apology for missing notes, you mentioned. Explain the reason behind the backache and urinary symptoms, you mentioned. Counsel about sexual activity, you didn't counsel. Encourage physiotherapy is urinary symptoms and as this may improve them. If symptoms of urgency and urge incontinence, consider bladder training, you mentioned. Offer a fluid diary, you mentioned. Information gathering, complete history to help understand what was done, assessing progress of surgery, fitness to go back to work, elicit the concerns about urinary frequency, certain anxieties about sexual intercourse, you didn't, inquires about after symptoms, incontinence, hesitancy, urgency of voiding dysfunction, inquire what fluid intake she is taking, offer to review notes to get more information about the medical history. Communication with colleague here, senior colleague, involvement of physiotherapists, discuss case with the consultant, consider referral to urogynecology if no response to the conservative line of management. Patient identity, patient safety, let the patient take informed choices regarding the treatment options. Recognize the implication of missing notes, empower patient to make informed choices, double a certain drug allergy, no, balance benefit versus risk of no, this is not actually, this must have been. Okay, accepting as a complicate, accepting. Okay, so this is you very nicely you accepted that this is a complication of surgery, explaining the treatment for the same, that is reassurance. You do not need to scare me, you just need to reassure me, understanding your limits, when to involve senior and when to refer to a specialist or MDT. Discuss course of recovery following sacro-colpopexy, discuss the complications, backache 10 to 15%, and risk of detrusor overactivity also. Discuss investigation, treatment of overactive bladder in a simple measures. You are not going to go in detail and explain me all the options. You are just going to go in up to certain extent conservative. Next will be medical line of management, and if not getting treated, then will be the next line of management will come up. Support group is bladder and bowel UK. Okay, so BBUK, this is a support group, and information leaflets are available in most of the format. You can go through it. Okay, anybody is having any question? No.